Welcome everyone to a new episode of PADA Spotlight. Today we are talking about travel in a part-vaccinated world. My name is Rung Thep Gale and I'm the membership manager for engagement at PADA, Pacific Asia Travel Association. For today's episode of PADA Spotlight, we have partnered up with SimpliFlying and their partner TestFRWD. And I'm very excited to hear about their thoughts and ideas. I don't want to talk too much because we have a lot of presentations and discussions. So let me just quickly introduce you to today's speakers. So we have Shashank Niman from SimpliFlying, the CEO of SimpliFlying. We have Dirk Singer, the research director of SimpliFlying. And then we have Ander Eichbichler, the CEO of TestFRWD. And I'm your host. And then, of course, we have, for the panel discussion later, we have our moderator, Paul Broncan, who you might know already, our Director of Communications and External Affairs. And we will have an introduction by our CEO, Dr. Mario Hardy, who I will give the stage in a minute. Just a few words before we start talking about the topic. So there is a Q&A box where you can submit your questions. So throughout the webinar, if you have any questions, please feel free to submit them in the Q&A box, and we will have some time later to answer some of those questions. In the chat, you will find valuable links regarding the presentation. If you mention anything, we'll try to share that in the chat. And I would say, without further ado, I will hand over to Mario for his introduction. Hello, Mario.
Good morning, good afternoon, good evening to everyone, and welcome to this new webinar today. It's a great pleasure to be with you. You know, all of us have probably heard the word COVID-19 millions and millions of times in the last few months. But when we think about tourism and the tourism recovery, how we move forward, which is the critical part, we have to think about the fact that this crisis is very unique and very different from anything we've ever encountered before. The recovery will be slow, and it will be uneven, and it will be gradual. So it means that certain destinations around the world will open before others, and some may not open for quite some time. So how do we cope with these differences and these different protocols for crossing borders from one place to another? There are already so many that are actually being in discussions in different countries. Health Pass and the Common Projects and many other private entities who have created similar systems and protocols, as well as testing protocols and the combinations of other services. Our advocacy, our mission, our message to the governments, whoever is listening from a government entity at the moment, is we encourage all of you to work together hand in hand to come up with a standard to help ease the recovery moving forward, that are hopefully one solution moving forward, if not at least at a regional level, to assist us to travel in a much easier way. So today we'll hear different ideas of how one company, SimpliFlying, and their partners are introducing ways to simplify the testing process and allow us to move forward. I think it's important that when we talk about vaccination, there is not a one solution. We'll need to have a multitude of solutions moving forward. In addition to vaccination, testing is certainly one of them, in addition to others. So I look forward to today's session to learn more about the different services that SimpliFlying are actually offering and how it can actually help our industry to move forward so that I and you can all travel again fairly soon. So thank you very much. Back to you, Rose.
Thank you, Mario, for the introduction. And yeah, without further ado, I would like to welcome Shashank Niman and Dirk Singer from SimpliFlying to start with their presentation. Hello, Dirk and Shashank.
Hi, Rome, and hello, Mario and Paul, and thank you so much for the kind introduction, Mario, and for the opportunity to share some of our thoughts and perspectives on how travel is going to reopen post-pandemic. Now, as Dirk puts up the slides, I can give you a very quick overview of what we believe and why we believe what we believe is happening. Our perspective is that COVID has leveled the playing field when it comes to customer experience in travel. The airline that can own the customer journey, including testing and health passports, will stand out. Don't leave the travelers to fend for themselves. The hotel that can offer free PCR testing in the lobby for anyone staying more than 2 days will be full. The country that waives quarantine requirements for vaccinated people will see its beaches packed. The tourism boards that redefine their target markets for the millennial remote workers or the 60-plus golfer will stand to gain. This is the time when we have to think differently about the future. This is the time when we cannot hope for the old normal, but not just expect the new normal, but proactively create it. And that's why our presentation today is focused on the future, on what this future might look like, and exactly how all of us in the travel and tourism industry can play a role in shaping the future. Dirk, if I can have the next slide, please. I'll give you a very quick overview of how we at SimpliFlying have been doing this before inviting Dirk to lead through some of our research. In the last 12 years, SimpliFlying, we are headquartered in Singapore. We have worked with over 100 airlines and airports in building brand trust. We've become really well known for our work in digital. But in the last 1 year, we questioned, just like 10 years ago, building brand trust required providing customer service on Twitter or selling tickets on Facebook. Today, building brand trust requires COVID safety and taking care of health and safety for travelers from around the world. This is why in the last 12 to 14 months, we've focused only on helping airlines, airports, tourism authorities around the world deal with COVID and come ahead out on top. We've created a global safety certification for airlines called, in partnership with Apex, which is a health safety standard. Over 15 airlines are already rated within the first month of launch, and we are currently auditing more than 30 other airlines. We have launched what's called Fit to Fly, which is an online portal in which any traveler can seamlessly book a COVID test right in the booking path of the airline. They can walk into a clinic, or they can even order a mail-in test as Spire or be a partner from TestFRWD will share later on. Imagine if you are Barbados and you say, you know what, I want to keep my local population safe, yet I want to reopen tourism. How do I do that? Well, mail in a test kit free of charge to anyone who has a ticket booked to Barbados, and voila, you have a COVID negative person coming in with a standard test no matter where they are originating from. So there are ways to think creatively about this. We are going live in Mexico today with some of the largest airlines and the tourism authorities there to open it up for travelers. So without further ado, let me invite Dirk Singer, SimpliFlying's research director, who will hopefully share some new and fresh insights into what the post-pandemic world looks like.
Yeah, so thank you, Shashank, and thank you also for the introduction. What I'm going to do is I'm going to quickly run through 12 trends that we expect to see in a part-vaccinated world and a partial recovery world in terms of aviation and travel. And then I'm going to hand over to Fight from TestFRWD, who will talk a little bit more about the solution. So I will go through each of these quickly one by one, and we have a longer presentation if you contact us afterwards that we can send on to you. So to go to the 12 trends that we're seeing right now over the next year to 18 months, the first thing that we're seeing is a new form of flight shaming. As I'm sure all of you will remember, flight shaming was a term coined by the environmental movement, about 18 months ago to shame frequent flyers for supposedly burning up more of their carbon footprint than is responsible. And the new flight shaming is a growing awareness that travel spreads disease, and especially, I have that picture on the left. There was a case in Europe of a lot of so-called social media influencers going to Dubai. The popular press picked this up. There were pictures of them having fun. Meanwhile, people at home were having to be stuck in their houses. It's a UK phenomenon, but our Danish colleague Mark tells us that in Denmark, this was also a thing. And in Denmark, they actually talked about Dubai shaming, to sort of talk about the people who went to Dubai for the Christmas holidays while people were stuck indoors. In Canada, politicians have even had to resign for traveling. Even in some cases, though, it was for family and for compassionate reasons. The new strains change everything. I mean, we've all heard about the Brazilian strain and the UK strain and the South African strain. Just the day before yesterday, there was news about the California strain. I saw various scientific figures and COVID influencers talking about it in social media. And the inevitable responses that I saw at the end of it were loud calls for the borders to shut even further. Now, of course, the thing about the California strain is that case numbers and hospitalizations in California are actually going down. So it remains to be seen how much of a threat this is. But the point is there's heightened awareness of things that could undermine the vaccination program, and that is causing governments to sort of get tougher. And that means that travel bans are popular. There have been opinion polls done in Canada and the UK, just to give two examples, which show that large majorities support a complete ban on international travel until COVID cases come down. And of course, the backdrop to that is very much the sort of the new strains that we've been talked about. And one side effect of that is that restrictions will get tougher before they loosen. To give us sort of a very, high-profile example, we all know that Israel is furthest ahead in terms of the vaccine program, having vaccinated around half its population. Yet on the 29th of January, Israel shut its main international airport, and it's still not reopened. And there's a new rule apparently coming in place for next week, where only 200 travelers per day will be allowed into the country. Similarly, Kuwait, the day before yesterday, announced that all borders would be shutting until the 30th of March due to COVID. In Europe, Germany has closed its borders to the Czech Republic and to Austria because of fears of the South African strain. So right now we're seeing things get even tougher, and that trend will probably continue for the next 6 weeks before they start to loosen up again. And of course, that also means that travel restrictions will be the last to go. The schedule that most governments have in place is that first come schools, then come outdoor gatherings, then comes non-essential retail, then comes hospitality, then comes domestic travel, and finally, then comes international travel. And speaking about a European context, we could see that happening from June, July. In the UK, where I am based, the government has set a date of the 23rd of June for all restrictions to be lifted. And of course, there's a lot of caveats on that. And so Aer Lingus, for example, has estimated that from June, July, they will be flying 70% capacity. And that's possible, depending on a number of factors. But as we said in the introduction, the recovery will be patchy, it won't be everywhere. It will be some destinations opening up before others. One of the things, for example, that Aer Lingus has done is in the expectation that, that continental Europe will open up later, is they're moving some of their planes to the UK and to Manchester to possibly fly transatlantic to the US. So certain routes will open up before others, and it will be an across the board opening. Biosafety measures will be key for the consumer experience. Airlines are putting a lot more emphasis on biosafety and on sanitation to reassure passengers, and that will be a key part of the passenger experience going forward. Testing is here to stay. This is something that Mike will talk about in the next presentation, but bearing in mind that we won't see widespread vaccinations in some areas of the world until next year or 2023, or if the Economist Intelligence Unit is to be believed, they actually put a few countries down as 2025. That means that some form of testing will stay with us, even for countries which are fairly far ahead in the vaccination program. Of course, we have to remember that only adults are being vaccinated right now, and children will not be vaccinated until Q4 at the earliest. That means that if you're going on a summer vacation with your children, you will have to have some form of testing. Now, if you're testing children, you obviously need to have more seamless and user-friendly testing solutions. And again, that's something that Mike will talk about in the next presentation. In some countries, vaccines will certainly ease the entry process. One of the most high-profile examples is the Seychelles. The Seychelles is obviously a small country. It has already vaccinated around 40% of its population, and it is allowing travelers entry into the country with an approved vaccine and to skip quarantine. Now, obviously, one of the important things about this is that it has to be two-way. It's going to be a big disincentive if you can go to the Seychelles, for a week's holiday, But then if you have to come back to your, to your home country, if you then have to quarantine for 2 weeks, possibly in a hotel, you're obviously going to think twice about doing that, which is why some of the travel corridors that we're seeing, for example, the one that Israel has agreed with Greece and Cyprus, which will potentially allow two-way travel for people who've been vaccinated from April, are very important. The idea of a vaccine hierarchy, this is something that we could well see. Yesterday, many of you will have seen the news came out from Johnson & Johnson that their vaccine has proved very effective against all the strains, including the South African strain. The Oxford AstraZeneca strain is less so against the South African strain. It may still prevent serious illness and death, but we could well see that some countries favor certain vaccinations more than others. Looking at the Chinese vaccines, the two main ones, the Sinopharm vaccine has proved to be very effective, according to the UAE. It has about 8% efficacy, but the Sinovac one, which is being introduced in a number of countries such as Brazil, Turkey, and I believe Indonesia, only had 50.4 efficacy, which is still more than the flu vaccine, but it could well again mean that there is a certain vaccine hierarchy when it comes to the travel environment. The age of the pandemics is here. I mean, this isn't going to go away. This has been seared on the public consciousness. And there's already talk about the next pandemic. And certainly something that we are going to have to bear in mind. And on that, environmental and pandemic concerns will merge. There was quite a well-publicized speech by Dr. Mike Ryan of the WHO last week, where he talked about the fact that human encroachment on the environment and global warming was making the prevalence of zoonotic diseases much more likely. And that is one thing that I think we can expect to see, is that the environmental campaigners who never went away, they will be sort of approaching the travel industry again once the worst of COVID is over. They will start talking about pandemics and about one reason why to cut down on greenhouse gases and to cut down on so much travel is that it makes another COVID much less likely. So very, very quickly, things we think the industry needs to do. First of all, to recognize public concerns. I mean, in-flight transmission is important, but the reason why borders are closing is because of fears of transport of the virus. And we have to hit that head on and come up with a blueprint, come up with plans that will reassure the wider publics that, that travel can benefit economies, save jobs, but also not spread disease. Actively promote health passports. I mean, I agree in the introduction that we very much need a standard in terms of health passports. The moves coming from the anti-travel pass is very, very positive. There's an initiative run by MasterCard and IBM and other consortiums that are trying to come up with a standardization. And that is certainly something that I'm trying to see. Look at the passenger journey holistically. So obviously it's not only the actual journey, but every single part of it, from transport to the airport to to what happens at the airport at the other end, to transit to your hotel. Save the summer. Really we need to invest in testing and biosafety now. As we said, testing is here to stay. Track and trace and exposure notifications should be part of the passenger ecosystem. In the US, it was announced that airlines will now be sharing that data with the CDC to make locating passengers and outbreaks much more likely. And then finally, have a long-term plan. As we said, the pandemic isn't going away. And just like the travel industry had a sustainability plan, we now need a pandemic plan that will look forward for the next 1, 5, 10 years, and that will engage with the inevitable concerns about preventing more COVIDs and preventing more pandemics. That's it. And on that, I will stop sharing my screen and I will hand over to Veit, who will give the next presentation.
So hi, everybody. So now we heard something about the trends and the predictions, what we think that will happen in the next few months and maybe even years to come. I want to share a little bit something about solutions that are already there. We as TestFRWD, we have developed in the last year, in the midst of the pandemic, a self-collection kit for a PCR testing kit. I just want to say two things about testing. The first problem we have with testing is that there is no international standards around that. So a basic problem for the industry now is trust. And to be able to build up trust, we need to make testing understandable, we need to make it accessible and we need to make it easy. And one way to do it is a digitalization process around testing so that people can do it at home anytime, seamless, and at a very low cost level. I will show you a quick video that explains in very, very briefly what we do and how this works. So basically, what we've seen here, I don't know if I'm out of the presentation. So basically, what we have seen here is our collection kit that enables you to collect a sample, a saliva sample, a mouthwash sample at home. And the whole process is digitally monitored for one reason, because for travels or also for events for players in the tourism industry, we need to have a proof that the person who has now a certification in their hands is really the person who has done the test. And of course, we have to prove that it's done in the right way. Decentralizing testing, of course, has a couple of big advantages. The first advantage is we can control and have a liability standard around who has been tested, has done it right, which is very important to make it seamless. And the second part is we have digital data, which is very, very important to be able to integrate existing structures like airport entry control systems with those data, so that with this data, so that we can then control seamlessly the health status of people and do it in an anonymous way, because of course we do not want to share our health data with everybody. A problem that we see is governments are slow. International organizations are slow in deciding. Of course, there's many players involved. And what we've seen is IATA, for example, has a lot of standards for airports, for airlines, for quality, for a lot of things that have been set up throughout the last years. When we look into the testing regime, we've seen that there is basically no standard around it. It might be that IATA says, look, we're not responsible for that. That is a governmental thing. But what we have seen in the last year, it will take months, if not even years, for the WHO or for governments to come together and create international standards. So what we need to do in order to make testing seamless and to build up trust is we need to define quality standards for the different testing platforms, meaning from PCR, this is what we are doing with our test kit, which is very safe, to rapid tests. We need an independent and traceable security layer to prevent fake and minor quality products. We see a lot of fake products on the market, especially rapid tests. We need a standard for automated data exchange so that we can integrate the already existing digital systems with result databases. We need, of course, a standard for layout, design, form, and language or certifications, because we also see there a huge problem. If you travel, some countries issue the certifications in Russian only. How could somebody control that in a country where they don't speak Russian? Testing requirements should apply for internationally, for regions, for not only for small regions. What does it mean? There's different rules of what a positive case is, even within Europe. So we cannot even compare the data. And of course, we have to try to integrate automated testing processes into the booking process of tickets, bringing the dependency away from the people so that they can easily access testing. I want to quickly, so that maybe I share some understanding around that, go through what the differences between the testing platforms, as I called them before, are. We have on the one side, we have rapid tests. On the other side, we have PCR tests now. Rapid tests, like antigen tests, they have a couple of advantages. They're basically instant. The result is there in a couple of minutes. It's cheap. You need no laboratory, but it's very unreliable because if you have a lower virus load, you're asymptomatic, usually they will not tell you that they offer a very short or provide a very short safe time frame, meaning after an antigen test, in reality, 8 to 12 hours later, I could already have developed a virus load that can be dangerous for people. And of course, an antigen test can only be used and only be certified by somebody who's a health professional. And there we have the problem with the standardization, because if I say in some countries, if you go somewhere and say, look, I have to fly out here, I give you $5, maybe he will just give you the stamp. So there is no security layer around it. On the other side, we have PCR tests that are very reliable and accurate, have a longer time window that is safe. It's also possible that you do home collection, because as we have shown in the video as well, we can create a digital process around it that proves that you've done it right and that it's you. And of course, we have a vast network of certified laboratories worldwide already in place that are conducting PCR tests and that have usually a security layer already there, so that we have certified results that we can deliver. The cons are, of course, you need a lab. The result takes longer because you have to get the sample to the lab, you have to process it, and of course the costs are higher for those reasons. Also, I want to share quickly the differences between the different collection methods. This is something that most people did not, and even the WHO did not really think about in the last months. We have seen in the PCR segment, which is basically the one that is used for travel, so you need a PCR certificate to travel. The WHO has recommended all three versions, so the mouthwashes, the swabs, and the saliva tests. But what we have seen is that there are differences in what they can do for you. This is also something where we need a standard, where we need to understand what will be the method to collect. I want to go through it very quickly. The nasal swab, as you can imagine, is a very good tool for clinical analysis. Why? Because basically in PCR, it does not detect the virus, it detects virus RNA. You cannot say if the virus is still reproducing or not. After infection, it takes a while, a couple of hours, maybe a day or two, until the virus goes up into the cavities here of the nasal area, which is quite a good sample method at the peak of the infection. But there's a problem. As soon as the virus stops reproducing, so after infection, the nasal cavities, they're not washed out regularly, right? Because through eating and drinking, the mouth area here, you wash it out every day. So what we have seen is that with a nasal swab, even 3, 4, 5 weeks after the infection, you will still have a positive. On the other side, we have saliva and mouthwash collection, where, of course, they're painless. They have a couple of advantages as well. But the main advantage for the industry is that it's a very reliable method, but still, we do only detect active cases. What the industry needs is a methodology to identify active cases, because we don't want to bear people from flying or from traveling if they don't pose a danger to others. And this is one of the reasons we're lobbying a lot also internationally and in contact with the WHO and a lot of entities around that, because the nasopharyngeal swab is a clinical tool. It's not the right tool for what we aim for at the moment. I want to share a small chart on how this could work and what we're doing with the airlines as well. So basically, we integrate the testing process into the booking process of a ticket. So take it away from local entities and centralize it on the booking platform. Basically, with the flight, you get a test kit sent home 48 hours, maybe 24 hours before the flight. You take the test will then be picked up either by UPS or DHL, or there are drop-off points, or there's different setups, will then be processed by a lab. The result will then be stored in a central database where entry control systems can connect to. So what does this mean? This means the customer journey gets very, very simple and very seamless for travelers. And of course, we have the possibility here to introduce a standard, a quality standard around testing without waiting for government. Because what we can say is, look, we only work with labs that meet special requirements. And that way, we think that we can also build up trust in the test results that are delivered through the airport, airline, or the booking systems. And it would be a standard where we don't have to wait for anybody. Waiting for governments, and this is what we have seen in the last year, and the public entities, is an impossible thing. It will be a process of years to find international standards around that. The legal frameworks to do it on our own are there. You can already travel with a PCR result. I mean, this is not a problem, but every country, every region, every continent still has its own rules. What we think and would be important is that the industry understands that the legal frameworks that are here already can be used to introduce a standard unilaterally, because it will do what it has to do. It will build up trust, it will simplify testing, and of course, it will bring prices down a lot. And this is what we aim for. So thank you very much. I would say we go to the Q&A, or if there's any questions.
Yeah, thank you very much to all the speakers, Shashank, Dirk, and Veit. Very interesting and insightful presentations. Before we jump into the panel/Q&A session, I would like to remind our audience that please submit any questions you might have in the Q&A box. We have a few there already, so use that chance to just ask away whatever you have. And then I would say, Paul, I'll hand over to you for the Q&A panel discussion.
Well, thank you very much, Ru. Well, thank you, Shashank, Viet, and Dirk. Thank you for the great presentation. Let's just jump right into this. There's a couple questions already here. I have a couple questions myself. So my first question is really to Dirk. You know, you went through the trends, and one of the things is the health,
sure.
And it's something that we've pushed a lot here at PADA. But recently, I saw this question on my social, on my one of my social media channels, and someone had mentioned, like, look, we already have a sort of a health passport. We have the yellow passports, right? That why couldn't you just add another tick box to that and then just say that, well, that's now the health passport? Why do we have to then create a whole new health passport? Well, I mean, I don't know if Dirk can answer this, but Shashank's nodding his head. So, I mean, you guys want to answer that question?
Yeah, Shashank, go for it. So why don't you take this one?
I think, Mario and Paul, you would be aware, yellow fever card is many decades old. And it's a physical paper. I think it's somewhere lying in my passport pouch. I think it was last used when I flew from Ethiopia to Bangkok, actually, many years ago. The first thing is it's not digital. And that is the biggest thing that leads to, if you're flying out of Africa, you would have seen that there are fixers outside the airport selling you that yellow passport so that you can board your flight. There are issues around fake passports, which has been the case around fake COVID tests as well. And using digital technology, using digital authentication, we now have the ability to ensure that there is very little or no fraud. As Payat mentioned, that identity verification using your own phone, we now have the power in our hands to ensure fraud in travel is down. And that way, starting from scratch, a digital health passport, which is not just for coronavirus right now, it pandemic proofs travel for the future as well. And that's the big thing. Feel free to add.
Yeah, absolutely. I think that's an absolutely key point. As we said in the presentation, the age of the pandemics is here, and the health theatre will become as important, if not more important, than the safety theatre has been in the travel space. And we need something that works for the long term. And absolutely, we need to guard against forgeries. One of the downsides of presenting PCR test certificates at a lot of airline check-in desks is that they've been pieces of paper, PDFs that you print off, which has led to a number of high-profile forgeries and to a thriving black market in terms of selling fake certificates. So, so we do need some kind of digital standard that verifies that what you've got is actually what you did get rather than what you paid someone for.
And then everyone in the industry has been pushing like, yes, we need a digital health passport, right? Why? What is the holdup then? Why haven't governments and international organizations, like the UN, like why hasn't this been implemented? What is the big holdup from that happening?
Maybe I can answer that question. We have, in Europe only, we have 29 different standards around what a health pass looks like. We have 29 standards in Europe only on how this data gets into the system. When we talk about one country only, this is a viable solution because we can say, look, all our people, they will have a new standard. But when we talk about travel, there is no use in having a standard only for a small country like Austria. We need a standard that is accepted in Germany, that is accepted everywhere. So this can only be achieved on a very high level, political level, on the level of a WHO, on the level of at least, let's say, a European Union. And their discussions have not even started around that. Everybody is saying it's a good idea, let's do it, but nobody has a clue on how to legally do it, because you can imagine the US will not be very happy to share the health data of their people with a country in Asia. We understand that. So the discussion around that has started, but what we see is it will be years, at least lots of months, until we come to an agreement on an international level. So what we think is that a player like the IATA can introduce standards for themselves, going around the governments, the 170 governments that would have to agree to an international standard, basically creating a template for a standard. This is a little bit what we see. If we want to move quickly, we think that the organizations that are impacted most will have to think about that now. Otherwise, we'll be in the same situation in 2 years.
Yeah, I mean, so IATA's one is a great step forward because a lot of people, they're the airline association, so they're really pushing that forward and getting the airlines, the private sector to sort of lead that way and hopefully push the governments to accept that going forward. So, another back thing to Dirk's presentation, right? We're talking about vaccine hierarchy. But what about for destinations like that are fully vaccinated, right? I mean, like if you're like, I heard like Palau will probably be fully vaccinated fairly soon, small population, working a lot with the US in that. So if the whole island was fully vaccinated, I don't see there would be a problem for them just to open up borders, or is that more of a concern for governments as well?
Well, I mean, if we look at sort of, I mentioned Palau is a good example. I mentioned also the example of the Seychelles. And the Seychelles, as we said, which is allowing travel if you've been vaccinated, but you still do need a PCR test. I mean, the Seychelles is a population of under 100,000. And they expect to be fully vaccinated by April because they've received a donation of the Sinopharm vaccine from the UAE government, and they're well on the way to sort of distributing amongst the population. Again, with the Seychelles, if you look at the type of profile of traveler, the average person coming to the Seychelles does not, that person does not go on a city break. That person goes to the airport, transports onto a sort of, onto a smaller plane, goes to the resort. At the resort there is social distancing. There's training in COVID safety measures, and that is low risk. And so you're right, for island countries like that specialize in that form of tourism. I mean, the Maldives is another example. It will be easier for them to open up first. As we said earlier, of course, it has to work two ways. You have to know that when you're going to the Seychelles or you're going to the Maldives, that when you go home, you're not going to be stuck in a hotel for 2 weeks. Paying in the UK, it's, I believe, £1,700, for hotel quarantine. So it has to be a two-way street.
Yeah. I've always talked about how everyone kept talking about, the vaccines here. And I always said, well, the vaccines here is great, but I don't think people have started talking about that next step after the vaccine. So, thank you very much for doing this presentation, to have a discussion. I think we need to start talking about that now as we're as we're looking towards post-vaccine. Now moving on to Viet and sort of some of the testing that you have, the labs I would see would probably be one of the biggest cons, as you mentioned, right? You would need to see if we were to have the self-testing kit here in Thailand. I mean, you would need to find local labs here in Thailand and sort of every single country moving forward, because sending that biomaterial across borders would not be possible, right? I mean, if you had the self-test kit, it would be, it would have to have a local lab in every single country. Is that correct? Viet, did you hear me?
So, sorry. Yeah. I didn't hear you. The connection was really bad.
Sorry. Yeah. So, you said that the labs were one of the biggest challenges for the self-test kits, right? So, I mean, you would really realistically need to have local labs in every single country that have been certified by the government, because you can't send that biomaterial across borders, right?
Yes. So you're absolutely right. But the one main scope of when we developed the kit was full compatibility with existing structures and assays. So what we have seen is that basically everywhere internationally, we have validated now on maybe 25 different assays. We have a couple of 100 labs now that we work with. So basically we see that it's very compatible. What we can do from our side is, because we do the sample collection, we transport it ready-made to the lab. What we can say is, look, if you want to work with us, you need to meet some basic standards. We don't care if your government says, no, you have to report if the standards are lower. We have a standard and you have to follow that standard. So basically what we can do is we can, first of all, through the digitalization system, we can integrate a lot of labs around an area in the region. What the app does basically is when you finish the collection process, it will choose the next available lab in the network. So this brings transportational logistics times down. And of course, what this means is if this lab has no capacities left, we choose the next one and the tested person does not even know that. So we can level capacities over a whole region. We can bring prices down a lot because labs don't have to collect samples, labs don't have to report, labs don't have to do all the administration around the testing itself. And we can introduce a standard for how every test that is conducted with our mouthwash collection is done internationally. This is what we are doing. So we have also taken it from the governmental international organization level to a private company level, because we have seen there is no other way to do it. As I said, only in Europe, we have around 20 different standards for what a positive case is in PCR. We have countries where they say, if you're over 30 CT, you're positive. Others say 35. We have seen 28. So, you can't even compare the results between the countries, even if they come out of a PCR lab, because politics have got involved. And some said, well, to get down numbers, we just, get down quality. So this
just to add to what Fahad is saying, what we've done is with these mail-in kits, we've made it so easy to use the existing labs and the existing infrastructure that already exists in countries that are already processing PCR tests, that you can process in any lab that does PCR tests right now. So we already have partnerships in the UK, in Northern Ireland, for example, to process these mail-in kits for Europe and for the UK and Ireland. We are currently getting certifications done in Mexico, and we are exploring similar arrangements with local labs in the Philippines and other parts of Asia.
And Shashank, you said mail-in, but in your presentation you said they're pickup. So is it a pickup or do I mail it in, right?
It really depends on where you are. We have countries where pickups work perfectly, then it's pickup. But we have countries where, of course, the logistic services are not reliable, and as turnaround time is vital, we have always to look to the region. If there is no good logistic system there, we choose drop-off points like DPD or one of the big logistic providers where you drop it off. In Germany, in Austria, where we have a very reliable logistic system, we work with pickups because they're very reliable. But it's of course, a big question remains around logistics, but there are different models that can be implemented very quickly.
Yeah, but having said that, last mile delivery is one of the key important factors. So yes, they can be mailed and picked up from any normal address. And we are working with not just the national post systems, but local specialist delivery services that, for example, deliver Amazon Prime boxes in Mexico. And in Mexico, they don't really have addresses, they have landmarks. This shop is opposite another shop and you have to find it. But this Amazon Prime guy has delivered boxes there. So we can work with him to do that. So yes, it's great applicability to tourism boards because you can say, hey, I have booked, there's this passenger who's booked a flight to, let's say, Thailand. You're in Thailand right now, or to Koh Samui. And there's another passenger who's booked a hotel in Koh Samui. Both of them can be mailed these test kits, 2 test kits actually, before they depart their home country. One test kit to be used before they board their flight to Koh Samui, and another one they carry with them and they take the test while they're in Koh Samui 2 days before their departure back to their home country so that they can avoid quarantine on both the sites, if you see what I mean.
But then, yeah, and it could also work as sort of just to add to that. I mean, it could work that, you know, you partner up with major hotel chains and major resorts that, you know, that especially for package tours, that you leave the kit in the guest room 72 hours beforehand. He or she takes the kit, drops it off at hotel reception, and then the hotel reception sends the batch of the kits of all the guests off to the local lab. The results come back, and that person has the correct result before he or she, you know, goes to catch their flight home.
And maybe I add just one thing. What we've seen is with airlines and players in the tourism industry, they have already done a great job in finding labs. Local partners have partnered in basically every country with somebody. They didn't care for standards. It's just like, if you do PCR in a country, do it for us. What we see, the opportunity we see is, it would be very easy to say, look, if you want to partner with us, use the digital system, process these samples. I mean, it's compatible. There's no problem around that, so that we can then offer an internationally standardized testing system integrated into booking platforms and basically bring together all the different leads and contacts and labs that the different airlines have already built up. This is a network that is already there throughout the last year, but introduce a standard that it will be the same everywhere. And you have to imagine a traveler who goes somewhere. I mean, if he did this test once, he knows how it goes. And well, he does it 2 days before he flies out. He does it a day before he flies somewhere. No matter where he is, it will always be the same testing standard, the same packaging, the same way of doing it. So this is what we aim for, because we think this is what it's needed to be able to reopen international travels.
All right. Well, I want to get to some of the questions. I think we only have like 5 minutes left. So I'm going to go with a question here from Jerry. Viet, great idea. Are you suggesting that the fast track solution with testing is working with airlines directly on a testing system that is endorsed by governments? I just want to add to that question. So, I mean, if you partnered with an airline, does that mean the cost then is sort of part of that airline ticket, or is it a separate cost? I mean, that's my addition to Jerry's question here. So, this for you.
I can go ahead, Fred.
So it also depends a lot on pricing. In Austria, where our test market is, where we do mass testings for PCR, we have brought prices down for a whole PCR to about $8, including lab, including the kit, including everything. We see other countries where we have not been able to be large scale for now, where the cost of a test is $80, $90. I think this will also answer your question, because if you have an $8 cost around the test, well, I think an airline could even absorb it or price it into the ticket. If we talk about an $80 test or a $100 test, it gets more complicated, because first of all, it is a barrier for travelers who travel for leisure. If you really need to travel, you need to take the test. The costs are not important. And this is also something that is, we didn't even talk about this, but this is something, of course, that where we put a lot of pressure on local lab structures, because the real costs of a PCR in a lab are around 75 cents of a dollar. We do not understand how an industry during a pandemic can charge $80 for something where you have 75 cents costs, including in a European country, including personnel and everything.
Yeah.
So you see where the whole thing is moving.
Exactly. And to add to Fayad's point, just to show you a live example right now, we're launching this in Mexico with an airline called Volaris. It is the largest budget airline there. And what we've done is, you can see this, you can book a test. This is the page that passengers will come to in the booking path of the airline. So when you choose your seat, you check in a bag, you click to book a test, and you come here and you can see it's fully branded in the airline's colors. You can book a test for certain prices. These prices are currently way cheaper than the current PCR and antigen test being offered in the country of Mexico. So you can go there and see all the labs that are there. You can order mail-in kits, that's coming soon with TestForward kits as well. And you can just basically schedule an appointment. You've got your FAQs, you've got the process, and you can find out basically what needs to be done. It's very simple. And Paul, to your point, currently the cost is included as part of the airline ticket, but there's nothing to say if this Volaris logo is changed to, Singapore Tourism Board, and Singapore Tourism Board says, you know what? I know that an average Indonesian spends $2,000 in one trip to Singapore over 5 days. Am I willing to pay as a tourism board $100 for a PCR test to cover this cost of the test, to remove this cost barrier, to say, you know what? This is 5% cost of marketing. That's cheaper than Google's CPA of running ads. And am I willing to get this negative tested, safe to my community tourist to come and spend money and come back and restart travel? I think this is a very innovative model for tourism agencies, for airports and airlines to promote travel, to not necessarily pass the whole cost to the customers, and to negotiate better deals. And we can help with all of that.
Yeah, just another idea on top of that. I mean, over the summer, we were talking to the Canary Islands head of the COVID Tourism Task Force. And one of the ideas that they were exploring at the time, which I think is still under consideration, was to offset the cost of a test for passengers coming to the Canary Islands with vouchers that you spend in local restaurants or in local attractions. And that, of course, has two benefits. It offsets the cost of the test to the traveler, but it also puts money back into the local economy. And of course, the local economy, which desperately needs the tourism, dollars and euros. So that's another way that it can be done. And I thought that was quite an interesting idea that the Canary Islands were looking into.
Well, we sort of talk about these costs. I mean, how much is it going to raise? What's the indication? This is a question from Suma. Well, what's the indication of the cost? Or, I mean, how much is it going to be if it's part of the air ticket? I mean, what's the percentage or the cost, the indication of the cost of, I guess, the test?
I mean, we're seeing antigen tests at less than $5 right now, and PCR test costs are dramatically coming down to less than $50 for certain regions as well. And these costs are constantly going down and down and down. And as Fayad said, the cost of the test is not a lot. It's really the labs that are charging and sort of making money in this initial wave. And as the pressure on testing facilities decreases globally, you're going to have more testing capacity freed up, and the prices are going to go down further from there.
I don't know if it's a question, but it's a comment. I mean, Sarah Matthews is saying that there's already self-tests already with no need for any lab verification. I guess she's based in Hong Kong, so I guess she's talking about maybe Hong Kong has a self-test with no lab verifications. Do you have any comments about that, or
I think Dirk and Fayad are on top of this.
Yeah, so there is a lot of rapid self-tests out in the market, but what use you have in having a test result if you cannot prove it? I mean, why countries install travel restrictions and testing regimes is because they want to know if you're infected. What we see already is a self-test is useless if you cannot connect the verified result to the person. I mean, I can do a test it's positive, and I say, look, I need to fly, so please, can you do the test for me? Because I need to fly anyways. And this is what happened already. Around fake certificates, around all those things. So self-testing, yes, we are also offering self-tests, but we need a verified result, because this is also the problem with what you said before, vaccination passes. We need a verified data set in there. If you can put it in yourself, if you can print it out at home, if you can build it up in Photoshop, then it's no use, and this is not a certification.
I'll take this question. This is one from Gary here. His question is, a big issue for integrated vaccine info system is that the development is dynamic. Several new vaccines will be approved in different countries this year. How do these become incorporated into a global system when several countries and perhaps COVAX may not approve them for their own populations?
There are two ways of looking at that. The first is, if we find the technical standard to have an international vaccination pass, that wouldn't be a problem, because, okay, this is the one or the other vaccine. A different way would be to say, look, whatever vaccine you got, we require an antibody test. An antibody test gives you the result of, have you been vaccinated, or even did you have it? However, you don't pose a problem or a danger to others. So I think what we will see is kind of a transition period around that, where at first place, vaccinated people will have to get a verified antibody test. And then it will have, like, let's say 3 or maybe 5 months of a safe time frame where you can travel freely. If you don't get vaccinated, well, okay, then you have to get an active control test, like a PCR or maybe an antigen, to be able to travel. And then you will have a time window of a day or 3 days, depending a little bit on the regulations. I think the idea that we will see a vaccination pass, an international one, is very far away. But an antibody test, the cost is around $3, $4, $5 at the moment, gives you a very long time frame of security. So, and it's basically compatible with all the vaccines, let's say it that way. So if you have antibody, it will show it to you. So I think this is one of the things where we have to move away a little bit from the idea that we will see vaccination passes immediately. But what we will see is antibody tests that will prove that you are vaccinated.
Well, I think we're out of time. I think it's like 1 minute before 4, and I'm sure Room is probably telling me to hurry up. So, well, I'm sorry we couldn't get to all the questions. We had a lot of questions here. Viet, Dirk, or Shashank, I guess we have like a few minutes before we wrap up. So if you guys want to type in your answers to any of the questions, feel free.
Yeah, I'm trying to answer as many as possible.
Yeah, try to answer as many questions as possible as Room wraps up here. So thank you very much, Shashank, Viet, and Dirk. And thank you, everyone, for letting me moderate this panel. And I'll see you at the next session. Over back to Room.
Yes, thank you. Thanks, Paul, for this panel. Thanks to all the speakers. While you're typing your answers, I'm also happy to forward you the questions if they have been sent with a name and an email, so you can reach out to these people and maybe answer the questions later. Yes, thanks a lot for everything. If you have any questions, please feel free to reach out to us. We are happy to forward everything to the speakers. And with that, I just want to give a quick overview of the next webinar before we say bye. So our upcoming spotlight next month is going to be why tourism does need an education. If you're interested in this topic, you can sign up on our website. And yes, PADA Spotlight is a monthly webinar series where we have members speaking on a topic that they have a great expertise on. So I would like to wrap this up here. The recording will be available on our YouTube channel probably by Monday. So if you would like to share it or rewatch it because maybe you tune in a bit later, feel free to do that. And yeah, once again, thank you so much, everyone. Thanks to Shashank, Dirk, and Veit. Thanks, Paul, for moderating. And thanks, Mario, for the intro. And yeah, feel free to reach out, membership@pada.org. And with that, I would say, see you all hopefully next time, and have a good morning, evening, night, wherever you are. Bye-bye. Bye.
Bye. Thank you very much.
Thank you. Bye-bye.